We are a hot mess, my family. Yeah, that's right. We've been through the ringer. What I'm going to talk about a little bit is mold toxicity. We actually had to sell our house. Not only did my wife have Lyme disease. Again, she still deals with some ups and downs, but through this journey of even getting better, we actually moved, and we moved into a house that we thought was like the house, and her symptoms actually began to escalate, and we had some more overall symptoms begin to manifest more. They were a little bit different in the sense of neurological issues, numbness, tingling, muscle pain, and so we started to do some more research outside of that and some also testing, and found out that our house actually had mold. We ended up moving from that house, and so my experience is not just with Lyme disease, but as a secondary infection, a secondary issue was mold toxicity. Mold is it's a nasty thing, to say the least. I know some people think that it's just this black stuff that's on the wall or inside of our walls, but what people don't realize is the microspores that come through that. I learned so much about mold going through this. We did not remediate the house or do anything there. We actually just left in a matter of 2 weeks. We packed and we got out. We literally sold pretty much everything that we had or threw away most of what we had, and so we completely started over. Not many people know that story about us, but when my wife already had some suppression within her immune system and was already dealing with Lyme disease, we weren't going to try to risk anything, and so we left. Mold, in a sense of even microspores, I learned that mold can actually transfer through drywall. So even if it's on the inside, duct systems are a major area that mold comes in, and it's constantly being blown, and you're breathing into it, and then that gets into basically wet type mucus areas even within your body. So breathing in, getting into the lungs, and then it can have a systemic effect. There's, in a sense, like Lyme, which is kind of that great imitator. Mold can have those same effects. And mold can actually have neurological, it can actually create muscle tension, tightness, spasms, clonic conditions within the muscle tissue. So this is another reason why we utilize ozone therapy, because ozone can actually help to kill off mold. Again, it has the antipathogenic effects. Now, with anything else, using something systemically, I would be utilizing IV ozone and recommend IV ozone for this to have a systemic effect. Rectal insufflation, vaginal insufflation is a good one, because again, mold likes to go to areas that are wet, that are moist. Utilizing boo, or even the ear insufflation. So when it comes to mold, because it can actually manifest and go everywhere, I like to have a multi-systemic effect, doing it in different areas. Having that systemic effect through IV, doing the ear insufflation is a major one, but even drinking ozone oil. So I try to hit every area when discussing mold with patients as well.